Hi, everyone, and welcome to Making It on Monday. This is a weekly workshop for mums and dads in the making. And today we're talking all about herbal medicine and how it helps with fertility. And I was asked a few months ago, actually a year ago now, I was asked to give a presentation for a fertility symposium, and it was all about evidence-based Chinese medicine herbs for female fertility. And a few months ago, I thought, why haven't I presented this Making a Monday? Because I'm sure there's a lot of people out there who are either using Chinese herbal medicine or perhaps thinking about like what else they can do to help improve their fertility, and that maybe they've just got some questions about how does Chinese medicine herbs even work, and potentially like what is the research out there around it, like why would it be worth doing it. So today we're going to talk a little bit about Chinese herbs, how they might help and support female fertility, and we're going to talk a little bit about the physiology around how Chinese medicine herbs help. And then we're going to go through a couple of studies which have shown how they can help. And we'll talk about evidence and then how that's applied in practice. But, it's not going to be all dry. So please stay involved. I'd love to have you along today for Making It a Monday. So Making It a Monday, this is a weekly workshop for mums and dads in the making, and it's brought to you by the Acupuncture Pregnancy Clinic, and we're an integrative traditional Chinese medicine clinic. So we work alongside other healthcare practitioners and doctors to try and give our patients the most comprehensive care possible. And today I'm your host. My name is Amy Forth, and I even today have a little slide about who I am. So I'm the director of the Acupuncture Pregnancy Clinic. I've also been a researcher involved in research around integrative medicine, and so how we can best integrate the best of complementary medicine and Chinese medicine alongside mainstream care. So I'm super passionate about that. And I have also been involved in a lot of research around Chinese medicine. So today I'm giving you a little bit of my kind of research flavor, which, I'm going to try and make it super exciting so no one's falling asleep. So please stay with me. All right. So today we are going to talk about traditional Chinese medicine. And for those of you who don't know, it's been around like a really long time. Gynecological texts with traditional Chinese medicine, they go back like 3,000 years. But initially, it was like inscriptions on tortoise shells about plants that might be used for female fertility. And that's about 400 BC. But then, we fast forward to about 200 AD. And at that point, they had like 30 different herbal medicine combinations, formulas is what we call that. And they were used for, a comprehensive variety of different fertility issues. And then if we're moving forward a little bit and we go to say like 600 AD, by then we had like over 283 gynecological syndromes. And there were the textbooks, there was like 7 volumes on gynecological disorders. And then about 1000 AD, by then there's like 10 chapters on infertility, 20 chapters on menstrual disease, and so on and so forth. I won't bore you with all the details, but the reason why I absolutely love Chinese medicine is because we draw on this very rich, like 3,000 years of history, and this literary tradition, which means that we've literally got these amazing textbooks that we can read about gynecology, about female fertility. And that's what first brought me to Chinese medicine. I was really impressed with the history and that how many different syndromes there were around gynecology, around things like irregular cycles, around painful periods, and also around infertility and pregnancy care, and how many different ways there were to potentially help people with these issues. And that's what made me really super passionate. So let's get into it. Chinese medicine, you might have heard of the 5-element theory. So basically, it's a theory that there's a lot of different elements that need to be in balance in the external world, but also in the internal world. But how this relates to herbal medicine is that all these different elements have a different taste. And so when you're tasting your Chinese herbs, that's got a lot to do with how they interact and what they do in your body. So I just wanted to give you literally a taste. what Chinese herbs, what they do and what that taste does. Because some of my patients say, oh, I can't handle the taste. But what's really interesting is so often they will say, I don't like the taste when they initially take it. And they'll say a couple of weeks later, I actually really like it. So potentially, as they start to get a bit more imbalanced, they start liking the tastes that are good for them to bring them back to balance. This is my theory. So yeah, this is a bit more about Chinese medicine theory, which I don't want to go into in great depth, but I just want to give you a little taster because I think it's super, super cool and super interesting. And 5-element theory is all about there's 5 elements in the body, and these need to be in balance, and they all correspond to a taste, which I talked about previously, but also an organ, 2 organs actually, a yin and a yang organ, and also a season, and also an emotion. So these are all the things that can actually play a part in terms of that element being in balance. That's for another day. So clinical practice, if you've come into our clinic before, if you've seen another Chinese medicine practitioner, you probably notice that they really want to have a look at your tongue, and then they're feeling your pulse. And from there, they're going to really understand what's going on and what's out of balance, as well as what you've told them. And from there, they're going to make a diagnosis. And according to that diagnosis, that's where we're going to come up with the most perfect Chinese medicine herbal formula for you. Okay. And it's going to have to do with a whole bunch of things that, like your thermals, things like that, your yin and yang. But again, that's for another day. Let's get to the nitty gritty, to the research. So the first one I want to talk about, this is called Siwu Tongue, and this is a pretty old formula. I think it's around 400 AD that this one came out. It's only got 4 herbs in it, which is super unusual for a Chinese medicine formula. But this herbal formula is often used in conjunction with this second herbal formula that I'm going to talk about. These herbs, Romania, Angelica, Peony, these ones are used all the time. So if you're seeing a naturopath or a Western herbal medicine, check your bottle. I put money on that potentially one of these might be in your herbal formula mix, particularly if you're seeing them for infertility. So the study I want to talk about is a mouse study. And what they did is they got some mice and they induced premature ovarian failure by injecting CY. And once they injected it, they then wanted to evaluate what were the follicular development and how that changed when they had this herbal formula, Siwu Tongue. They also did a little analysis, and they found there was these specific components that were very active: gallic acid, ferulic acid, peony, lactoferrin. You can look up loads of research around these and see how they impact in terms of fertility. But in particular, what they found was that in the mice which had the premature ovarian failure, they found that they actually recovered follicular development. And this was by improving the oxidative damage. So oxidative stress often will come as we age, and it also comes from toxins and things like that, from such as cigarettes and alcohol. All these things are all oxidative stress, which decrease the quality of our eggs. So this is something we want to kind of overcome when we're looking at like egg health. So, and they also found that Siwu Tongue actually improved the pregnancy rate of the premature ovarian failure mice. So in conclusion, they thought that this herbal formula potentially is it's definitely an antioxidant and improves ovarian angiogenesis, which means it helps improve ovarian follicular growth. And potentially this might be a really good future treatment for women or, other people who have premature ovarian failure or aging ovaries. Now, the next one I'm going to talk about is a randomized control trial. And like I said before, both of these herbal medicines are used together. So stay with me because you're going to see how it all makes sense and how it might be actually in your herbal formula that you're using today, particularly if you come to the Acupuncture Pregnancy Clinic. So there's 99 women and they looked at Lu Wei Di Huang 1. And this is a kind of like a classical, like a modern classical formula. And basically they looked at them having this before they did an IVF cycle. For 3 months before, they took this herbal medicine for just like the 14 days during the follicular phase. So from when they get their period to when they ovulate, for 3 months prior to doing IVF. And so what they found is that it really dramatically improved the egg quality, how many eggs were picked up at also during IVF, and also the fertilization rates. So the Lu Wei Dipeng 1 group, so the herbal medicine group, had a higher eggs, embryos, and a pregnancy rate. And then we looked at, now the next one I want to look at is meta-analysis, and this was done by Reed. So it's kind of getting a lot of the research that's been done about Chinese herbal medicine. And this included 40 randomized controlled trials that looked at women using herbal medicine for infertility. And then they compared it to the mainstream treatment. And what they found was the mean pregnancy rates in the Chinese medicine group was about 60% compared to the 33% in just the standard care Western medicine group. So the meta-analysis suggested that taking Chinese herbs improved, had a 1.74 higher probability of achieving a clinical pregnancy rate rather than just like the mainstream care. However, there are some limitations that they were only looking at clinical pregnancy rates, so they didn't have a look at what the live birth outcomes were. And some of the trials only went up to kind of the clinical pregnancy stage, and they didn't kind of continue to measure outcomes. And some of the studies had like limited methodology reporting, on the methodology. And then there's one more meta-analysis we're going to talk about, and that is Quan, and I quite like this one. It was randomized controlled trials that were done in China. So in China, a lot of people doing IVF will do herbal medicine, and so there's a lot of research around it. And so you can see that the people who took the Chinese medicine, some of them were taking it before, some of them were taking during, some of them were taking before, during, after, quite a lot of a combination. But if you have a look, you can see that the majority were actually there taking either before IVF or during the IVF or FET. And so with the 40 studies, randomized controlled trials that they analysed using herbal medicine, they found that herbal medicine consistently did increase live birth rate and clinical pregnancy rate rather than those who weren't receiving it. They also found that the clinical pregnancy rate in the herbal medicine group was also improved in comparison to a placebo. And so here's just a little analysis in terms of live birth rate, clinical pregnancy rate. And you can see with no treatment, there was 297 people who conceived with no herbal medicine out of per every 1,000. And then with herbal medicine, 398 per 1,000. So it was quite a significant increase. And then in terms of clinical pregnancy rate, there was 364 per 1,000. This is the odds ratio, and then 503 per 1,000 with herbal medicine. So again, you can see it's like a big increase. So there were some methodological issues, and there's some issues with this slide, how it's anyhow. So with the live birth outcomes, they didn't have a placebo group to measure it with. There was also 10 of the studies had some incomplete data, which means that they were deemed low quality. And there's also differences, of course, between how much herbs they took, the type of herbs they took, and also when they took the herbs. So it makes it difficult for us, in the clinic to sort of say, oh, this is what we think works. But in conclusions, there's a moderate level of evidence to suggest that Chinese medicine may really improve clinical pregnancy rates, and it also may improve live birth rates. But what's really interesting is these are the most commonly used. This is where it all ties in, folks. So these are the herbs that were most commonly used in the herbal formulas in that last meta-analysis. And then I just want to point out that the top 3 in the blue, they are actually herbs that were in that seaweed tongue, that initial formula that I spoke about, around the mice and the mice that had premature ovarian failure and how it helped them recover. It helped reduce oxidative damage. So it's interesting that these herbs were also the herbs that were most used in this Chinese study. And then the most herbs, other whole nother bunch of the herbs that we used are in the purple. And these herbs, along with the blue herbs, are what we use in our own herbal formula. Sorry, actually, we've got this mixed up a little bit. So in Prepare to Conceive herbal formula, you can see the ones which are bold, and these are the ones that are used. We use this herbal formula all the time in the clinic, and you can see that they are very close to the most commonly used herbs. You can see are all in bold here. And then the purple ones are from that second herbal medicine I talked about, the Lu Wei Di Huang one. Sorry, there's a bit of confusion with the slides here. So basically, both of those two formulas, which I talked about initially around premature ovarian failure, with they were the ones in the herbs in the blue color, and then the ones in the purple color was the Lu Wei Di Huang one, was the one I talked about, where women were taking this herbal medicine in the follicular phase for 3 months prior to IVF, and they had much better outcomes. And this is the Chinese herbal medicine formula we use in the clinic all the time. So you can see that what we use is really based a lot on research and trying to give our patients, the absolute best. So overall, these are the herbs that we can see that were used in the research that are also in this formula. And one last study I want to talk about, which just kind of helps bring it all together, is this Hollander study. And so Hollander was a wonderful researcher, and she not only looked at what herbal medicine did, but she did what she calls whole systems. So she's looking at people who did both acupuncture as well as taking things like herbal medicines where appropriate. And they had quite a lot of acupuncture, so around 12 treatments on average before and during their IVF cycle. And the proportion of live births was 61.3% in the Chinese medicine group for this study. And she analysed more than 1,000 cycles. This was a post-retrospective cohort study. And I think this is a really nice study, because this is often what we'll do in the clinic, is that we'll see patients for quite a few treatments in the lead up to IVF and then during IVF. And I love it also because it includes not just acupuncture, but also Chinese medicine. And often the studies are just measuring one or the other. So I just wanted to finish up with that study. And here are the statistics you can see with the non-donor, the live birth rate was 61.3% in the whole systems traditional Chinese medicine group. So just to finish up, it's all about integrating the best care for you. So it's not necessarily just about Chinese medicine, but I think things like nutrition are incredibly helpful. Also, there's such a huge role, which, of course, IVF treatment or fertility treatment, ART, different interventions, of course, they are just so important when appropriate. So I just wanted to finish up with, our model of care is patient-centered, and I think this is the way of the future, that we should all be looking at integrating not only like with Chinese medicine, we've got a whole incredibly rich history and knowledge, but we also use this research, that current day research, to really inform our practice. And let's make sure that it's like really patient-centered. So all about what is important for you. If you want to find out more about research, if you're a nerd like me, I think this is a really great resource in terms of research. It's by the Fertility Society of Australia, and it's got some great summaries about complementary medicine therapy and the research that surrounds it current day. In the end of it, I just want to say, a team-based approach, a collaborative approach, working with naturopaths, nutritionists, counselors, specialists, GPs, physios, everyone. At the end of the day, we want to get her better results. These are my references. And if you want to find out more, please just get in touch or join at our fertility support group. It's a private group on Facebook. It's called the Acupuncture Fertility and IVF Support Group, or jump onto our website. My name's Amy Forth. It was great talking to you today. Making It on Monday. We're a weekly workshop here to help empower you through your fertility journey towards parenthood. Thanks so much for today, everyone. And I hope you have a fantastic rest of your day. Thanks. Bye.